Hello, everyone. This is Jim Sallis, and I'm happy to be talking to you today. And let me get my slides ready here. And what I'm going to talk to you about today, I call the environment and policy imperative in behavior change. So I'm really talking about what are some promising strategies to create lasting behavior change. So let me continue here. Here's my outline. First, health behaviors have multiple levels of influences that we don't always pay attention to or operate on. Ecological models have the potential for guiding us towards environment and policy changes to support long-term behavior changes. I'm going to give you just the tip of the iceberg of evidence supporting health-promoting environments. And I'm really going to be focusing almost completely on physical activity because that's the area that I know best, and we have many good examples there. But the principles apply, I think, to most health behaviors. And I'll end with a few ideas about next steps for research and practice. So if we look at the big picture of what's being done to improve physical activity, this is less true now than it was before, but it still applies. And I think we make minor investments in programs. Those programs are generally guided by theories that emphasize psychological and social influences. The primary goals are education and behavior change skills training, targeting individuals or small groups, and they're supported not very well because the organization of physical activity interventions is fragmented, poorly coordinated, and poorly funded. So if we look at the overall, what I call psychosocial models of health behavior, they generally look like this. The models show that behavior is influenced by biology, by psychological factors like attitudes, and by behavior change skills. And the social and cultural environment plays a role, but the social environment is usually examined in a narrow way, like your family or your coworkers or your friends. Will these individually oriented interventions ever be sufficient? And I argue that they won't be. They can be effective, though. We have plenty of studies showing that they can be effective, primarily in the short term, which creates problems when we're talking about long-term change. But I think they'll never be sufficient because programs, the reach is always limited. The effects are generally modest and maintenance is rare. And so that is not a recipe for long-term solutions. And maybe, perhaps most important, the individualized programs are not designed to change the root causes of current behavioral patterns. So I want to give you just an example of some root causes. But first, let's expand our model a little bit. The individual, the social and cultural factors are still important, but their reach is limited, as I mentioned, and their permanence is limited. So, but if we change the physical environment and we change the policies, then you reach virtually everybody within that environment or in the jurisdiction affected by that policy. And with some limitations, those physical environment changes and policies are relatively permanent. And so what does that look like? So think about if everybody had access to healthy food environments like this. You went into a food store, whether it was large or small, and you just had all of these colorful, healthy options. Well, that would be great, but I don't think that describes America. What we have in America are food environments that are designed to undermine healthy choices. And the Heart Attack Cafe is a good example. Come in and get your heart attack with deep fried butter and chocolate covered bacon, things that we are programmed to enjoy and love in some cases. So really plays to our biologically determined and our psychological weaknesses. So so we see this, but more frequently we see things like this, including I would call misinformation, defining healthy breakfast as bacon plus sausage and eggs, but cooked in olive oil. I guess that's the healthy part. And then we see this restaurant or Buffeteria Tubbies, and that's an odd name for a restaurant, in my opinion, that is clearly promoting unhealthy foods. And then here's something that amazed me by being short-lived. It was on TV for a little while, the Glutton Bowl, the world's greatest eating competition. And you would think in America that would be a big seller, but strangely, it didn't last long. Okay, now if we turn to physical activity, our environments and policies have changed so profoundly worldwide. Work used to mean actually moving and doing things, but now most work is computerized or automated or mechanized. And so that has changed physical activity patterns, again, profoundly. Another example is we have worked very hard to change our environment to make walking unnecessary and unsafe. And of course, walking is central to the whole history of humankind. But look at how much we have changed the environment to make that much more difficult. And so how did that happen? I'm going to stick with the transportation theme for a bit and take some lessons. So this is a graph of funding for federal funding for pedestrian and bicycling. And you will see that this graph starts at 1992, because before 1990, federal funding was banned from being used for pedestrian and bicycle programs. So, and if you look over to the right, at the peak there in 2009, with some of our economic stimulus, pedestrian and bicycling funding achieved 2% of federal transportation funding. And you see that's double what it was in prior years, 1%. All right, so that in fact is a policy intervention to promote driving and to not promote walking and biking. Well, let's see if that intervention has produced stable behaviors. And one other thing here. I love to show these actual U.S. postage stamps because they show how we've designed our communities to make walking and biking difficult by placing the places where people live, these subdivisions, far away from where they want to go. And that would include shopping and jobs and schools. And we've also made active transport impossible on our transportation infrastructure, like this interstate highway, where not only would it be incredibly unsafe to walk or bike, but it's prohibited by law. And think of the trillions of dollars that we have put into creating this inactive environment. So let's see, has this intervention been effective? Well, that blue bar that you see is the percent of people, of adults, commuting to work by driving, by private vehicle. And I would say that's a sustained behavior change since 1969, with a little bit of up and down, but still near 90%. And the walking and other would mainly be bicycling, has also been pretty stable. I don't think they probably measured walking in 1969, so that's why it's 0. But you can see over time, since 1977, it's trended downward from very low to excruciatingly low. So there's an example of interventions that have been effective in creating sustained patterns of transportation, although completely in the unhealthy direction. All right, here's another example with children where these interventions have been even more effective, because you can see that the light blue line is cars, going to school by cars, and that has gone up from 20% to about 60%. And the darkest blue line, walking and biking, has gone down dramatically from 40% to just above 10%. So in the realm of transportation interventions, this has been effective at getting people to use cars even more. But again, from a health point of view, it's been a bit of a disaster. Okay, now let's get into some evidence. So I want to focus on the design of cities. And after 20 years of researching this, my conclusion has been cities can be designed to move people or to move cars. But I have yet to see a city that's successful in doing both, because the needs of people, certainly walking and biking, are pretty much opposite of cars. So if we look at the two photos, the top photo on the left is, of course, Manhattan, which is America's most walkable community. The photo on the right would surprise you, because this is what I saw when I had an opportunity to fly into Cape Town, South Africa. So if we think unhealthy designs of communities is limited to North America, we would be wrong. So it's a worldwide phenomenon. So I'm going to show you data about the relation of walkability to physical activity and transportation behavior. So what makes a place walkable? One, a mix of uses. So Manhattan is everybody there is within walking distance of just about everything you could think of within just a few minutes. And you can see on the right, well, you can't really see, but this is virtually 100% residential uses. So there may be a few stores in there. I can't really tell, but this is a separation of uses on the right. Another thing we look for in walkability is connected street grids, and the grid of streets and avenues in Manhattan is famous and iconic, because you have direct routes just about everywhere you want to go. On the right, you don't have direct routes, because if you want to go from one side of either of these main highways to the other, those are not connected at all. You've got to go across this one bridge, and I don't know how you cross the vertical street. So very bad for pedestrians. And then higher density. In a lot of communities in the US, density is a 4-letter word. We don't want more neighbors. We don't want more traffic. But density is necessary because it allows mixed use, so that the places where you want to go can be close enough to you, and that there's enough population to support local shopping and local schools and that sort of thing. And the other thing that I'm not going to focus on too much here is we need to design streetscapes for safe walking and biking. And of course, in the US, we tend to do the opposite of that, so that there streetscapes in the US are by policy designed for moving as many cars as fast as possible. And of course, speed of cars is a risk factor for people who are walking and biking. So I'm going to show you a little bit of data, starting out with our neighborhood quality of life study that we did. We started 20 years ago with an interdisciplinary team, and we designed the study to examine, well, what's the impact or what's the relation of walkability to physical activity? So we had to make sure that we had variation in walkability. So we selected communities or neighborhoods that were low and high, and we also selected neighborhoods within the walkability strata that were low and high in socioeconomic status. That then assured us that we were not confounding income and walkability, but it also allowed us to examine the equity, whether walkability had equitable effects in high and low SES. So we did this study with adults, basically age 20 to 65, in the Baltimore region and the Seattle, Washington region. So we have a little diversity. So I'm going to first show you reported walking for transport minutes per day. And the green bars are high walkable. And you can see that there's much more walking for transportation in the high people who live in the high walkable neighborhoods. It's 2 to 5 times as high as in the low walkable. So and noticeable effects in both low income and high income. All right, so now let's look at total physical activity. Now this is measured by accelerometers. So we have minute by minute readout of how active people are. And this can be activity in their neighborhood, at work, in a park, it can be anywhere. But we're looking at how is that related to their overall neighborhood. And we do see more total physical activity in high walkable neighborhoods. And the difference by walkability, it doesn't seem that high, 5 minutes to 7 minutes per day. You know, you said, are we gonna, you might wonder if we're gonna really change the way we build our neighborhoods based on that. And but it's more important than you might imagine. So if we look at 7 minutes a day, that's approximately, or even less than, well, that would be more than 50 minutes per week, but let's just say 50 minutes per week. That's about 2 miles per week of extra walking if you lived in a walkable neighborhood, if you walked very, very, very slow. That would equate to about 100 miles per year. And roughly speaking, that would be an additional 10,000 calories per year. And roughly speaking, that would equate to about 3 pounds less weight gain, other things being equal, among people who lived in high walkable neighborhoods compared to low walkable. And we do see the expected differences in obesity rates across high and low walkable neighborhoods. I'll just show one more result from this study, and it's driving. And you can see that there's much more driving in the low walkable neighborhoods, and the results are similar by education, and that's about 100 minutes per week. Additional driving if you live in a low walkable neighborhood, because in fact, most low walkable neighborhoods create dependence on automobiles because they don't have enough density to support good transit service. And of course, by definition, you can't walk too much. So anyway, think about the relevance of this for climate change. All right, let me just, a little bit more evidence here. This is another one of our studies in adolescents. This is called a teen study. We also have studies in younger children and in older adults, but I'm just gonna give you a sample here. So this is accelerometer-based total physical activity with the same breakdown by income and walkability. And you can see we have basically the same results. Now, the overall amount of physical activity is much higher in adolescents, which we have come to expect, but the difference is very similar, about 7 minutes per day, as we saw in adults. And we see this over and over, and the same applies to older adults. The results are a little bit different for the younger children. Just one more thing, active transportation, or the ability to walk to school, is generally better in the high walkable neighborhoods. So we see more walking to school. So these are not prospective data, but the intervention is permanent. The intervention of the design of the neighborhood is permanent. And we looked at, do these results vary much by the time that these adults or adolescents live in the neighborhood? And it doesn't really matter that much. So there's maybe some reason to believe that these are relatively stable, or at least somewhat permanent effects on behavior. So let's move on. So there's now a lot of, hundreds of studies showing the relation between built environments and physical activity. So much so that the CDC's Community Preventive Services Task Force adopted this recommendation based on evidence. And this was based on prospective evidence, or natural experiments that actually changed the environment. So the recommendation is that built environment approaches combining transportation system interventions, places to walk and bike, with land use and environmental design, what I've just been showing you, walkability, is an effective intervention for physical activity. And I give you a preview that there's going to be a similar recommendation coming out soon about changes in parks and green spaces and recreational facilities, also based on prospective or intervention data. Okay, now let's take a look here. Research is not easy to put into practice, and so this is illustrated by if studies come out that sidewalks are really important to help people walk. It is not the case that the next day the cement truck comes out and pours sidewalks. It doesn't work that way. And on the right, it's even when cities try to do the right thing and put more sidewalks in, well, it doesn't necessarily always work out correctly. And I wanted to show this picture because I took it in the Denver area. So, Denver is trying to do good things for pedestrians, but it's hard. And so that's why my first research need is more dissemination and implementation research. We need to figure out how to get our research into the hands of decision makers within cities and states so that they can use it to change policies. That's a whole set of research in itself that we need more of. We also need research on the equity of opportunities for physical activity. There are complex patterns of disparities in physical activity. There are also complex patterns of disparities in physical activity environments that I don't have time to go into. But we need to address important questions like, what are the roles of historically discriminatory policies like redlining that have made communities of color and low-income communities generally less safer and for walking and biking, and less well served by recreation facilities like parks? What environment and policy changes could produce more equitable opportunities for physical activity? People are certainly working on that. How can we improve underserved communities for walking and biking without stimulating displacement? And I would say this is an urgent question that we don't have good evidence about right now. There are practices that people are doing and trying that need to be evaluated, so this is really important. And one final issue about equity is how can we use research to improve physical activity opportunities on tribal lands? This has not been addressed much that I know of, so there's another opportunity. And my last interventions recommendation is to focus more on multi-level interventions. And so this is the promise and the lesson of ecological models, that that if interventions work on changing influences at all levels, they have a better chance of being effective. So many interventions conducted in practice are multi-level, and these should be evaluated. There are great opportunities for practitioners and researchers to work together to generate practice-based evidence. And due to the nature of environment and policy changes, investigators and researchers cannot randomly assign them to individuals or communities. So appropriate designs are needed, such as evaluations of natural experiments. And these can be really powerful, and we need more of them. So multi-level interventions for physical activity are particularly challenging because of the need to collaborate with multiple disciplines and sectors, like transportation engineers, city planners, parks and recreation professionals, geographers, and economists. The list goes on and on. And so I want to end with one example of a multi-level intervention that has some evidence of effectiveness. And it's an evaluation of safe routes to school, which at one point was a specific line item in the federal transportation budgets. And these, so states could apply for grants and then implement them. And this is one of the evaluations. And safe routes to school programs are multi-level because of these of transportation model of how you do effective transportation interventions. It includes engineering, which is changing the built environment, includes education and encouragement, which are obviously focused on individuals and families. Enforcement is a policy intervention that focuses on the broader community, and then the evaluation. So it is multi-level in nature. So let's look at what they found. So they evaluated hundreds of projects in 5 states, pre and post the implementation of the intervention. And you can see that pre and post, there was no controls, but pre and post, there was an increase in the percent of kids walking from 10% to 14%. So that doesn't sound, that's not getting 80% of kids to walk, but it's a 40% improvement. And we would expect that to last as long as the interventions lasted. And you can see that there wasn't much bicycling before or after the interventions here. So this isn't, but it's an example that interventions are occurring, that multi-level interventions are feasible and can be done. And so this is a way to both use the evidence to stimulate more interventions like this, and to create more evidence by evaluating them. So thank you for paying attention to my talk. And if we were there in person, I would ask you to stand up, and I would probably lead you in a few minutes of activity. So maybe we can do that later. So thank you so much. And I am going to end the presentation there. So let's have a great discussion now.